Okay, so team, what I would like you to do is we've got groups 3, 5, 8, 7, 1, 9, 6. Gunnar and group, yeah, everyone's a group. So is Gunnar a group or is that the faculty?
That's faculty.
Fine, okay. And Lindgrill Larson, is that a group as well? Which group are you? You group 1.
We are group 2.
You're group 2. Okay, why don't group 2 come online and tell us what do you think learning is?
Okay, how do we do that?
You're doing it now. You're talking. Just speak. Complex stuff.
We think learning is having a new language and building upon something we already know.
Okay, good. That's nice. Group 1. Who's group 1? That's Karen, Karsten, Helga, Jaap, Peter. Can you tell us what you think learning is?
It's a shitty.
Okay, I think, can you hear us now?
Yeah.
All right, so one suggestion was acquiring and integrating new knowledge.
Okay, that's good. And the other suggestion?
We don't hear you right now.
All right, let's go to group 3. What do you think learning is?
You listen to our computers when I'm
Well, group 3, we've discussed that it's the process of reflecting and understanding a concept or some fact.
Okay, good. So I think it's important that we try and understand what learning is, because learning is not simply acquisition of new knowledge. A lot of people think that learning is the delivery of new knowledge. And what I share with people is that that's what Amazon does. Amazon delivers new knowledge to your house when you buy a book. And for many of us, that book sits on a shelf on the end of our desk, what the Japanese called sundoku, which is the book of the list of pile of books that we intend to read, but never actually get anywhere in reading. So that the foundation of learning is knowledge. We have new knowledge, something we knew nothing about. And then at the end of the process, we know more about that. But as I think what some of the groups have highlighted, there is more to learning than simply acquisition of knowledge. There's a group called Bloom's taxonomy who defined what is the taxonomy, the structure of what learning is. And they wrote their first paper in 1956, reviewed it in 2001, this concept of what learning is. Now, there are various concepts and it doesn't matter, but it's important that we understand learning has its foundation of new knowledge. But if I was to explain to you that the presentations that many people do, their principal aim is only to transfer new knowledge. What I want you to answer in your groups in discussion is, what is the problem with only transferring knowledge? Simply that download of information, because that's what the majority of presentations do. Go ahead and discuss why that is a problem, simply the transfer of knowledge. Okay, group 4. What do you think is the problem with simply transferring knowledge?
Yeah, do you hear me?
Yes, good.
For us, yeah, we think it's much more than just transferring, it's processing the information. Even if you hear something and even if you're engaged, it's hard to internalize it without having a process.
Okay, good. So that's your understanding. So what the problem of simply transferring knowledge is what? Why does that fail as learning?
If you don't engage the audience, then maybe they don't even want to start the process of learning.
Okay, so that's for the presenter. What about for the audience if their principal role is just to download knowledge? Why does that fail in learning?
Because it's not engaging. Maybe I'll ask a colleague here. Does anybody else have a thought? The best thing would be if you made me want you to give.
Okay, so that's about the process of learning. So that's absolutely right. And what you're pointing out is fundamental, is that both the teacher and the learner must want to learn. Okay, that's helpful. So group 5, can you help us further with what is the limitation of simply transferring knowledge? Why is that not enough in learning?
Yeah, sure. Yeah, we discussed a bit that people kind of acquire knowledge in different ways. The thing about new knowledge is that you need to kind of remember what you learn. Right. And that passes through kind of an well, some kind of reflection on what you've heard or what you've seen. That we had a discussion about.
You have to direct the way you educate to your crowd, so to speak.
Yeah, but you also need a discussion about, I mean, leave some opportunities for reflection on what you said, and maybe you can do that with asking a question or kind of trying to, well, get the knowledge in there, but make a few turns as well, and maybe even kind of end up in a question or.
Okay, very good. All right, so thank you, group 5. What I hope you're starting to understand is that what I'm doing at the moment is helping you with learning, in that if I'm simply to deliver tons of information to you, whilst that information is valuable and it may be different to information you knew before, what you must do to learn is to process that information in some way. There must be more than simply delivery of information, because as I say, that's what Amazon does. But what we have to do is engage our audience in what is called higher order thinking. And Bloom's taxonomy explains that the foundation of learning is knowledge. It absolutely has to be. The audience, oops, that's the wrong one. The audience must be involved.
You're muted.
Yeah, you muted yourself, Ross, sorry.
Oh, the audience have to be involved in the learning, that they have to accept more information, which is the foundation of knowledge. But beyond that, we have to move up in this higher order thinking to understanding. Now, the way that I explain that to people as an obvious sort of way is that if you were to give a lecture on rapid sequence induction of anesthesia to a group of surgeons and anesthetists, the surgeons and anesthetists will both receive the new knowledge, but the understanding of the anesthetists will be different. And so their processing of that information will be different than the surgeons, because you have greater knowledge about physiology and altered physiology. But beyond that, what we need then to do with our audience is move them up into the next space of understanding and analysis of what that means. So if I give this drug that you are now telling me I should give, what will be the effect on what I already know about physiology, and importantly, altered physiology? So not just the normal homeostatic state, but if I give that drug to someone who is significantly hypotensive, what will be the effect on that? And then the next step up from there is, okay, so now I understand what to do in terms of altered physiology, this drug. What about a different patient? What about a shocked adult compared to a shocked child? How will I manage that differently? And so eventually your audience, if you're teaching them on rapid sequence induction, will have new knowledge, analyzed and understood, evaluated, and create for them to then go and deliver rapid sequence induction, ideally, if that was the purpose of your talk. So my question to you is, do you believe that your education as educators or as students fulfills that? Now, I want you to write that down For yourself, my education fulfills that concept of learning. And then as a second, the education I receive fulfills that concept of learning. 1 minute, write down your answer and then reflect on those answers, because that's what this next part is going to be about. Do you believe that the education you deliver fulfills what we have just discussed about learning for what you deliver? And then the second question, do you believe that the education you receive, and that can include me, fulfills what we've spoken about in learning? 1 minute to think and reflect. Okay, so you've had a minute to think and reflect. What I would like you to do now is, within your groups, discuss what you have reflected upon. My challenge is not to criticize you and to say that what you do is wrong, but for you to start to reflect in a positive direction about things that might be an issue in the teaching that you deliver, and we all know that we deliver teaching, and then in the teaching that you receive as postgraduate doctors. 2 minutes to discuss within your groups, and then I'll come back to group 6 first of all and take it from there, from the discussion. 2 minutes to discuss what is your reflection on teaching that you have given and received. Okay, group 6, are you there? Can you open your microphone and tell us what you think about life? Does your education deliver effective learning? Can't hear you. I can see group 6, but I can't hear group 6. Okay, let's go to group 7 whilst group 6 try and figure this out. Group 7, does your education deliver effective learning?
Okay. Cool. Sorry, what we were discussing. Question again?
Does the education that you deliver, is it effective? Does it deliver effective learning? And the education that you receive, does it deliver effective learning?
Well, not always, but sometimes it will be do.
Good.
My experience, learning happens in the discussion and in the reflection of the topic that we are discussing. Okay. So at least when I prepare for some lectures or have bedside teaching, I usually seek the discussion with the learner, because it is in this process of reflection about what are we doing, why are we doing it, that I feel that the learning is really.
Good. Doctor, what is your name, please?
My name?
Yeah.
Jeppe.
Jeben. Thank you, Jeben. That is most insightful. I'm hoping that many people are like Jeben, that they understanding that there is more to learning than simply the transfer of knowledge, and that it's in the discussion that that works. Now, group 6, not a happy smiley face there, but have you managed to, there's the smile. Have you managed to connect and tell us why, what do you think about your learning and the learning you receive? Go. Okay, maybe if Mas can come and help you understand the complexities of this machine. Let's go to group 8. Morten, Oscar, Anders, what do you think about this education issue? Yeah.
We were discussing that we think it's very important to know who you're talking to.
Yeah.
Be prepared to who you educate.
Yep.
that in many cases it's easier to do maybe bedside or engaging in a dialogue instead of kind of, because I guess we, or at least I, tend to fall back into the passive version if I have 30 people in front of me and try to transfer something.
Why do you do that? Why do you fall back into the passive?
Probably because it's more complex to engage in dialogue in a bigger group.
Yeah. Okay. So what I hope you've understood, thank you, Group 8. What I hope you've understood is that there is more to learning than simply the transfer of information. That the transfer of information itself needs then to be processed by the audience, and that the educators ideally need to be involved in that conversation to try and figure out what is going on with the learners, because it may be that what you said to them about rapid sequence induction makes no sense to them, and so they need help to figure that out. So what I would ask you now to discuss in your group is, what evidence do you have that your teaching is effective? What evidence do you have that your teaching, either as an educator to large groups or to small groups, what evidence do you have that teaching is effective? Discussion for 2 minutes amongst the people in your group. Okay, we're back in the room. So we'll come to group 6 one last time to see if we can have your opinion. What is the evidence you have that your teaching is effective or otherwise?
All right, so we're just gonna, now we just figured that if you adopt the way you practice or how you think about the subject, then something obviously went through. So that would be on the individual level, where you feel that you're actually engaging and learning and you're modifying the way you go about things. And another way would be that if you are the one teaching, that you're actually invited back to teach again, because people think you're doing something good. I don't know if there is any like evidence published on the matter. We don't know about that.
Okay, so
but it needs to change the way you think about a subject or the way you practice.
Okay,
pertaining to that subject.
Good. So thank you for finally getting some input. Can we move to group 9? Well done in figuring the technology out. Group 9, what did you think? What evidence do people have?
I think we had more or less the same as the group 6, that what we actually like to see is the progression of skill or knowledge from the people we are trying to teach, whether it being in a seminar or in a hands-on situation, that we can see next time that some of the skills they didn't have before, they have now acquired. I think that's the best evidence that we can have.
That is the best evidence. Do you collect that on a regular basis?
We do competency-based education in anesthesia in Denmark. So
okay, well, that's for sure. So
we do
trainee who can
somewhat.
intubate, and then tomorrow they can intubate. So that's very good. So we can see that competency-based skills can be assessed. What about knowledge-based skills?
In the competency cards are also knowledge that you need to be able to convey to the one doing the competency card, which are like driver licenses for the expected non-complicated case.
Okay.
For example, intubation or CVCs. Right,
so that's valuable. But what about the presentation-based education? Our colleague in group 5, I think, was talking about that, you know, when there's more than 30 people, we become quite passive and just deliver information. Do you have evidence that that sort of information is accepted, processed, and turns into that change in practice that group 6 were telling us about?
Actually, as far as I remember, the evidence is very much in favor of no. that the large seminars or large classes, the conveying of information or the change of practice is very, very small. And also it's because when you do to large crowds, you're not individualizing the level of information that you convey to them from the level they were at when you start, just as you said with the surgeons and the anesthesiologists.
Okay, good. So thank you for that, Group 6, Group 9, and for everyone who's participated so far. What I hope you can see is that written down in front of you is an assessment of education. First of all, what we believe education is, and hopefully you've added something to that, sorry, what we think learning is. Whether you believe, whatever you believed at the beginning, I hope we have progressed your knowledge some to explain that learning is more than simply the acquisition of knowledge. It's the delivery of new knowledge, but then assisting your learners to process that and move through this taxonomy of thinking to a higher order thinking about that knowledge that they are then effectively able to use, as our colleagues in Group 6 and Group 9 had suggested, that it would change their practice. I knew nothing about rapid sequence induction. At the end of the learning process, I am able to deliver rapid sequence induction to a multitude of patients in a multitude of scenarios with a multitude of outcomes, hopefully good at the end. That was the first point. The second is that our belief is that education as it is currently delivered is not always effective in that, either of us as educators or of our students, or as students receiving that. The complexity of why that is, we're going to come to, but that there is space for education to improve. And the third thing is that we need evidence of how good our teaching is beyond people simply saying thank you. And with respect to Group 9, just asking you back, I don't know that just because I've been asked back to do this, that means I've been effective. It might mean that it's just Mass is a very good friend of mine and he needed someone to fill the slot and I happen to be available. It's not necessarily evidence that the teaching is effective. I'd like to think it is, and he has told me, so there is some value in that. But these three things are essential in our education, that we understand that there is more to what we are doing than simply the delivery of knowledge. So what I'm going to discuss with you in the next part is the science of education. The science of education and psychology is clear that the vast majority of education that we both deliver and receive is fundamentally flawed. I'll say that again, just for emphasis. The science of education, educational theory and psychology is clear that the vast majority of education that is delivered and received is fundamentally flawed. Now, what is important at this point is that, as one of your colleagues highlighted, there is evidence. There is a ton of evidence to support that statement. What is not important is that you know about it. Vaccination works. The fact that people said they don't believe the science of vaccination highlighted the problem we had in the world. Science doesn't care what you believe. And what I would like to do in this next part is be clear that what I'm talking about is the science of educational theory and psychology, and that if this causes you conflict, what you need to bring is not justification for what you do, but consideration that there may be science to support what I am saying, or ideally science to support what you are saying. One of the common responses here is something like, I am a visual learner. Here is a little bomb. There is no evidence whatsoever to support the concept of learning styles. Many of us seem to believe in this. There is no evidence at all for visual learners, auditory learners, tactile learners. No, it just doesn't exist. So what we're going to go on and do is consider the science of learning. Now, for many of us, what we like to do is to believe our education is very good and that the education we receive is also very good. But let's just discuss these two words, which in English we consider two of the scariest words in the English language: mandatory training. I'm sure that you have it in Denmark, Sweden, Finland, Iceland, and anywhere else that people have come from. Mandatory training, the training that we receive because it is compulsory in our hospital that we know about X, Y, and Z. And what I want to share with you is the reason we hate mandatory training is because it doesn't work. Not because we're bored, but because it doesn't work because of science. And the majority of mandatory training involves someone attempting simply to download a ton of new information to us. That is their message. Their supportive media, the slides, are bullet point heavy, and they fill the screen with tons of icons, tons of complex information. That further makes it difficult for us to learn. And lastly, it's usually delivered by some person who is at the bottom end of a hierarchy, speaking up to people above them in a position of dominance of the audience and not of the presenter. The audience don't want to be there. Usually the presenter doesn't want to be there, and they usually read out the slides to the audience. And the combination of that is why we know that although we have undergone mandatory training, it doesn't work. And what I would like to share with you is that outside of the one-to-one discussions, bedside or anesthetic table side, the vast majority of medical education does exactly the same thing. That there's an attempt to download a mass of information, that the supportive media is bullet point heavy text, and that the person delivering it usually fails to engage the audience, often simply reads their slides, perhaps with a little extrapolation, and that is why it fails. What I would like for you to do for the next 2 minutes is discuss that in your groups. Presentations don't work. Discuss. Okay, team, welcome back. We'll go back to group 1 again with our for our first response from the group. What did group 1 think about that statement?
Hello.
Hello.
Can you hear us?
Yes.
We actually very much agreed that everything you said is true, which I guess is a suck up kind of answer. No, but we agree that to a large part that is what our medical education was like. You know, a lot of very heavy lecturing, so to speak, to a very big audience. Well, we were also discussing how to get around that, because maybe a lot of the more efficient teaching strategies would involve not being one lecturer. You know, the ratio would not be one lecturer or one educator to 150 students. So that's one of the problems we were discussing.
Okay, good. And what I like that has happened there is that having posed your question, you have processed it and you've moved on to the next part of what this morning will be about and how to make change to that. And that's how education should be. So group 2, Massa suggested to me that this mandatory lecturing is becoming less frequent, that we're not putting 150 anesthetic trainees in one room and trying to teach them cardiac physiology. But what about online education, the modules that you're forced to do online? Do you think they're effective?
Which one of them, the sort of questionnaire thing, or like this one with the video on?
Well, what did you receive during COVID in the form of education? Did it just suddenly go to a lecturer delivering stuff online, or was it interactive and engaging?
We worked during COVID-19.
Okay, so you had no education.
No.
All right, forgive me. I do have to confess that as a surgeon, a pediatric surgeon, my COVID experience was probably a lot better than many of yours. And I apologize if I've minimized that. I'm an oncology surgeon, so we simply carried on operating. The only thing that made a difference was we were all wearing masks in the hospital. We didn't see the horror that you guys have been through. But can we come back to that question then? In general, do you believe that online educating of people by the standard PowerPoint was effective? That happened to some colleagues during COVID.
Yeah, no, actually, my little daughter, she was educated at home, and that was the way they did it. And and she's fairly clever, but I could see that she was losing concentration within a few minutes, because it is so hard to keep concentration up looking at a screen, and it's a passive media and somehow.
Yeah. Okay, good. Thank you for that.
Also the technicalities with putting the microphone on and off, and there's a lag sometimes. It's all these are draining energy and diverting your concentration from the actual topic.
Yeah. Okay. Good. Thank you for that, group 2. So we have 1 minute before coffee, and we're going to fika. That fika. That would be the thing to say, wouldn't it? What we're going to do is, before that, I would like you to try and remember the last presentation that you were at of this scientific conference, and simply write down 3 facts that you learned from that meeting. 3 facts. And once you've written those 3 facts down, you can have coffee. Now, my clock tells me that it's 09:29, so I'm assuming it's 10:29 where you are. I will be back online in 15 minutes time to restart what we're going to do. 3 facts. In fact, don't worry, because I know that you can't remember 3 facts. Most of you can't even remember the last presentation you were at, and we'll come to exactly why that is such a problem after coffee. 15 minutes. See you soon. Make sure you have a break and be back on time. Okay, it's 1:45. So I'm going to start again, assuming that everyone is there, or we'll check back in again. The summary of what we discussed in the last session was a discussion about what is learning. I hope you understood that learning is more than simply the transfer of knowledge, and what we have to do as educators or as students is to mute group 4 and progress through higher order thinking to move knowledge, both of ourselves as students or as our students, from understanding through analysis, evaluation, to creation of new actions, whether that is in a new way to, you okay, Mas? A new way to deliver rapid sequence induction or whatsoever. Now, what I challenged you at the end was to think about 3 facts that you might have got from the last presentation you were at. And the reason I was a little dismissive of that is because I know that people find it very difficult to remember 3 new facts from the last presentation that they were at. And what I want to discuss with you in the next period of time is the science of educational learning that supports the problem that we cannot remember 3 new facts. So what I'd like you to discuss in your groups is, why do you believe it is difficult for you to remember 3 new facts from the last presentation you were at? What is it that was the problem that makes it difficult for you to remember those 3 facts? Is that clear? Basically, what is the educational theory around why we struggle to remember 3 new facts from the last presentation that we were at? 2 minutes, go. Okay, can we go to group 2? What do you think the problem is with presentations as they are delivered and received that causes us to struggle to retain 3 new facts?
Okay, we were talking about that one of the reasons could be that we don't have gotten to use things we were presented. We learned something and then we didn't use it, and then it's difficult to remember.
Okay. And how much information do you think is delivered in the average presentation?
The average presentation, a lot.
A lot. Okay. So there's a lot of information delivered and we don't retain it. Yeah. Group 3, what do you think about presentations? About the message that's delivered?
Well, thank you for the question. I think, or we think, that they were heavy loaded and they required that we had to multitask, listen to the presenter, read out 10 bullet points, and also like process it in a few seconds before next slide. So
Absolutely.
that overwhelmed me. And sometimes it can also be, I don't know, the way we present and engage made it hard because it was
okay,
a very
so that's good.
program.
We're going to come to that part of the discussion, but the thing I wanted to focus on was simply the message which you highlighted, is that the volume of information that is delivered is vast. There's little time to process it before the next thing comes on. And so our ability to even deal with one segment of information is lost because of the next. And what I want to share with you about presentations, because that's where we are now, not just simply learning, is that the reason the vast majority of presentations fail is because we do not download information like our phones or a computer does. It's not like we can simply plug in to a USB bolt in the back of our head, cardiac physiology, download it, and then within minutes, we're able to deliver cardiac physiology back to the lecturer. That is not how we process. And this psychological fact is essential to our understanding of learning, that simply the continual stream of vast amounts of information, even spoken, cannot be processed and retained if there is no space. So what I hope you've seen I've done at the beginning of this is that whilst I've shared with you about Bloom's taxonomy, and that's the key fact I wanted you to work with, I've used various psychological skills and processes to help you understand that and process it and challenge it and reflect on it. And then my hope is that you've retained more about Bloom's taxonomy than you would have done if I'd simply put up a bullet pointed slide. And it's essential that we recognize that for presentations, the science shows that neither as students or educators of experience can we download vast quantities of information. And that's a real problem because that is the fundamental of the majority of pre-graduate and postgraduate training for groups of more than about 5 people. That we are sat in rooms where someone is reading out PowerPoint to us. And the reason we don't retain the information, it's really important that you hear this because I had one woman burst into tears on me at this point. The reason you have not retained information is because you cannot. It's not that you, Morten, or Jan, or Saskia, or Mads, or Gunnar are stupid and that everyone else is clever. It's that it's not possible. And this poor woman had believed for the last 40 years of her life that she had sat in meetings and all of her colleagues were downloading all that information and she was the fool because she couldn't do it. The reason you cannot retain information is because your ability to do so is limited by this thing. If I was to give you my telephone number, it's 07866371068. It's likely that some of you will have retained some of those numbers. It is exceptionally unlikely that anyone has retained all of those numbers. And even if I was to do it again and ask you to do it, it's likely the majority of you would come up with only 7 numbers. And in doing so, you would focus on those 7 numbers alone and nothing else that happens around us. What we can do is probably retain 3 pieces of new information after processing. If you think about if you got lost somewhere without your mobile phone and you ask for instructions and someone gives you a huge list of instructions to get there, you'll retain the first 3. The evidence is clear that we do not retain information as it is delivered to us in large quantities. Now, when it comes to the supportive media, what I call the P2, it's not important if you don't know why I call it the P2, but the supportive media, slides, what I want you to do is to discuss it in your groups. Do you think that contributes to education or detracts from the education and learning? Positive and negative, and what is the science behind what you have to say? 2 minutes, I'll come to group 4 for an answer for that. Okay, to group 4. The question was about supportive media and what do we think is the effect of the use of that on education?
Yeah.
You said group 4, didn't you?
Yes.
Yeah, but we had a discussion here, but they wrote down some stuff, but I don't really agree. So no, but we.
Excellent. That is what education is about. It's not about everyone going, I completely agree. Tell me what you don't agree with, Doctor.
In principle, I don't want to see any slides at all. But then I want to retain the information that's given. Even if you just present 1 or 2 facts, there's still a lot of information during the talk. So this has to be registered somehow and delivered somehow that I can look at it later. I know that's maybe off the topic we're talking about now, just how doing, yeah.
And we also talked about that the slides can be a necessity if the teacher doesn't have full knowledge of the subject they're teaching.
Mm-hmm. Okay, a necessity in what way?
That they can use them as holding points for themselves. And we were
well, ideally, I did a presentation yesterday with, I think you'd like it, pictures and 1 word, but I wasn't as grounded as I'd like to be in the subject to like really be able to just ping pong with my audience. So you have to be really prepared and know your subject, and maybe have had the presentation a couple of times so you know what to expect, so you can guide your audience.
Okay, so good. What you're talking about there is a degree of excellence, and what your other colleague is suggesting is that from a position of lack of excellence, and somewhere in the middle is where we need to get to. And clearly the expert may be able to deliver everything with nothing, but the complete novice feels that they have to have something there. That's helpful. Okay, group 5, what do you think about the use of supportive media in presentations?
To be honest, I think that the PowerPoint presentation has kind of killed a lot of educational skills that people might have. And personally, I think that my own medical education was kind of ruined because of the PowerPoint taking over. And that's an issue of people trying to convey too much information in a too short time frame.
Okay, so that's fantastic, because absolutely, I completely agree with that. My question to you then is, why did you let that happen?
I think, well, from my personal perspective, as a medical student, I didn't have any power to change it. And I also, my experience from that was that a lot of the people actually holding lectures were kind of forced into doing that. They were PhD students themselves, and they ended up talking about their own kind of line of science or research. So, but then I wasn't in a position to change that at all. So
Right.
now it's, I mean, it's, the further you go into your education, I guess the more power you have over it. But oh, and this is kind of oh, yeah, look at that.
Wow.
I'm sorry, what?
Exactly.
Okay, so you saw what I've done there. So I simply put a slide up and everybody immediately stopped talking. And I can see the lady in the pretty top there is actually reading what's on that slide. And what I want to share with you is the problem of supportive media, that the science is very clear that supportive media, as you are looking at it now, actually inhibits learning. As our colleague beautifully pointed out there, she said it has killed education. So most of you are trying to read that. And if I do this, just notice how much easier life is without that text being there. But as soon as it comes back on again, even although you don't want to read it, you're back to reading it. Now, what some of you may have noticed is that is even in a different language. Not there, but as soon as it comes back, you're going to desperately try to interpret it. And what I want you to do is not look at the text. It's almost impossible, isn't it? And the point that I'm making there is that text has to be read in a linear structure. We are forced by our brain to process that. And that processing is one input. But at the same time, there is an auditory input. And this input is virtually always in conflict because most of us can read faster than the presenter can speak. And even if they simply have got bullet points about the next thing that they're going to talk about, we will read those bullet points rather than listening to the presenter. So what happens is you have two competing inputs. And what usually happens is that we will prioritize one over the other. You have now gone back to trying to read the slide as opposed to listening to me. And that however hard it is to do that, our brain is wired to make sense of linear structure. I don't know why it is, because when we were running around in the jungles, we didn't have text. But now, as soon as text comes up, you are like a hypnotized chicken. So let me just show you a hypnotized chicken to show how easy it is for us to be distracted. A line in the sand, and this chicken is hypnotized. Now, nothing bad will happen to the chicken. It's not, you know, it's going to be fine.
It's really weird that they stare at it.
It is weird that they stare at it though, isn't it? But just look at how ridiculous that chicken is when all around it is threat and probability of bad things happening, and all it is doing is looking at a line in the sand. It is not processing anything else. And that is exactly the same for us when we stare at the text on a screen.
Like he's lost his face.
The evidence is that PowerPoint stops learning. They have stopped doing research on this. The fact that you have not read the research does not change the research, but text on a screen in front of you inhibits your learning. So there are many reasons why we have text on the screen, as colleagues have pointed out there. One of it is that we need place setters. Another is that we need support. Another is that we often want to use it as a download. So we'll print off our slides to give them to our audience, all of which is valuable, but stupid in trying to do everything in the same thing. It's like taking your iPhone 13 and using it as a hammer. It does that job too, but it really is not the best job. And that what we should be doing is concentrating on changing all those other things. And at first, when I used to share these ideas, I've been very negative about this and not really understanding the value that PowerPoint, whatever it is we're using on the screens behind us, has value. But what we must accept is that the science shows that whatever you think about the reasons for using that, or your professor, or whoever else is trying to get you to change your slides, it actively inhibits learning. Now, when I say something like that, what usually people will respond with is that there is a place for some images in our presentations. And usually it's something like a data table. So if I was to talk to you about the CRASH-2 trial of the use of tranexamic acid in trauma patients to reduce their risk of bleeding, one of the main problems that North American physicians have, I don't know why, is the risk of vascular occlusive events. So if I wanted simply to highlight the fact that vascular occlusive events have no increased incidence in the CRASH-2 trial, I might use this data table that you see in front of you. But ask yourself, what have you looked at in that data table? It was all unnecessary information about other parts of the trial rather than the first line. So what we then see is that people use tricks to try and make things better, such as this, putting a red box around the key thing in the table. And what I also know is that immediately I do that, you will look outside of the red box. And so what we find in the use of supportive media is that people actually make things even more and more complex than they need to because of, I don't know why. What I'd like you to consider in your groups is, why do we make complex images in our PowerPoint presentations? Why do we add complexity by graphs and tables and diagrams? 2 minutes. Okay, back again. Group 6. What are your thoughts? Group 6.
Yes, everyone is hiding here. But no, our thought was just that we probably want to, if people actually give you the whole table, they just want to make sure that it's not what I'm saying, this is what the actual paper said, and then they try to highlight it. But we also said that if you actually bring up like it's often that people give a complex graph and they don't really explain how to interpret the graph. You're just sitting there and you're using a lot of your own energy to actually try to compute all the information that is coming. So maybe you should be very wary of what you're trying to communicate. And you need to think that you are actually saying some things, and that should be like a complement to the pictures, as well as the pictures should be complementing what you're saying, so that both make sense and that both are actually relevant for the listener.
Very good. The science is clear that it takes 3 seconds for us to interpret an image simply. So if I was to put up a picture of some description and you figure out that it's a man in a car driving across a cliff, if the image is more complex than that, then your attention is distracted from what the speaker is saying. And so what we have to realize is that the media should support what we're saying, as you correctly pointed out, that the two should work together. But if there's conflict, or if they are so complex that you can't figure them out, what happens is we blank out the speaker, we focus on the screen and try and figure out the table. And for many people, the tables that we use are massively complex because we take them directly from the documents themselves. So group 7, what have you got to add to this discussion about the complex images that people use in tables and graphs?
Yeah.
Well, we were discussing that you have different audiences, and what we should do is divide our presentations to and adapt to the different audiences. So we're mostly used to scientific presentations, that is mostly advertising rather than education. And when we educate, we don't adapt to that we have students in front of us.
Okay, that's a very useful phrase that I am going to borrow for the future, that scientific meetings are advertising. And I actually think that that's very useful because when I do this talk in more detail and go on with that, the fact that data is presented does not change how people interpret it. And what we are required to do is persuade people in marketing and advertising for them to believe and accept our information. And that comes back to this Bloom's taxonomy, that if we simply deliver knowledge, data at the bottom, we have to be able to interpret it. And the process of interpretation is the responsibility of the presenter or the educator to help the audience through. And that if we help them by putting titles and explaining what's on a graph, rather than tons of information, then that will make things easier. Okay. What I would like you to do in your groups now is to discuss what problems you think online presentations add. Why did online make this worse? 2 minutes. Why did online education make the delivery of education and principally presentations worse? Okay. Group 8. What did group 8 think about online presentations?
Group 8 is with group 2.
Oh no, that's chaos.
No, but just you can say that.
We had to do that.
Okay.
To put some noise. We talked about that the online education gave the issues with that people can tap out, or they can temporarily leave the sessions. There's these technical issues where the sound and the pictures are not working well all the time, and you lose some social interaction by being in the same room as the other colleagues or the teacher.
Okay, so that's very valuable, that the technical issues can prevent both effective transmission of information, but also that it's easy to hide behind a blanked out video screen, and that when we have multiple tabs open on our computer, we can also open up Twitter and Facebook and your emails and all those sorts of things. So that the engagement problem is a significant problem with the online milieu. Let's go to group 9 then. Beyond engagement, what technical problems do you see that might limit education?
That was a difficult question. We didn't talk about the technical problems outside.
Okay, sorry. What the same question I asked group 8 effectively. I'm just describing it differently. What problems do you think related to the educational science make online learning poorer than face-to-face learning? Or did you? Whatever was it, what were you talking about?
I actually had a question if are we to accept that online education is worse than IRL education? Because personally, I'm not sure, but I guess if you have the evidence for it.
Okay, so tell me why you think online education has value.
Well, actually, I've attended some sessions from home where I'm alone at home. No one is disturbing me. I sit in my favorite sofa and I can make my own cup of coffee or tea. And then I attend a session that I'm actually really interested in. And I choose to attend that session. For me, I think that's quite a good way to focus. But if you have the evidence that it's not as good,
okay,
I'm to accept that, of course.
Well, no, we don't, because of course, in many of these things, there's a complexity. And what you're absolutely highlighting is that if you're comfortable, if you're at home and you don't have to travel 100 kilometers and sit in a room with people who you think might give you COVID, and you've got a nice cup of coffee and your dog by your lap, then you may be more relaxed and be more able to focus than you would be having to wear smart clothes in a stuffy lecture theatre where you're not happy. And so we must accept that there is value in that. Let me ask you again, sorry, what's your name, Doctor?
Anna.
Anna.
Yeah.
What sort of learning do you, when you're doing that, when you're watching these presentations, did you just simply focus, or did you add to that experience by doing different things whilst you were learning? That's a bit of a leading question, Anna, but what did you do that you think made the learning better? Was it
Well,
simply being in your own home?
yeah, it was in my own home. Yeah, but I could take notes if I needed, but I think I just it made me be able to focus and to alltså ta emot, vad säger man? Receive the facts and interpret
Okay.
them and
Can I ask why then that is better than being in real life, lecture theatre or whatever?
well, I'm not sure it's better, but in this situation, I was supposed to be at work together with a really big group, and I don't know.
It's okay. It's not what I'm trying to provoke is discussion, and it's great that first of all you're respecting my opinion even though I've not given it to you, and secondly you're challenging it. So that's education. The evidence is clear that the majority of education, the way it is delivered, is poor because it disengages the audience, because the audience, you see simply the little icon in the bottom right-hand side of the screen. You can't see a face who's looking at you, talking to you, Anna, and asking you questions. And so we end up watching TV. And when we're watching TV, we don't have to engage with TV. It is true that as learners, we have the opportunity to have my notes beside me, to reach over here and check something on my phone just to see, well, I just need to check that reference whilst the doctor is talking, and do things. And potentially in asynchronous offline learning, we can pause and we can actually stop that flow of information and go and check things. So that asynchronous learning is probably better because we have control over it. The problem is that the vast majority of online learning is delivered using bad techniques, which are themselves made worse by focusing it down the tiny little camera. So I think you're right, and it's very valuable that you've shared that. Thank you, Anna. Can we go to group one now? Do you have anything to add to this discussion? Okay, good. Thank you, group one. At least we know you're there, but succinct answer. And that's valuable. I'm just trying to engage you all. What I would suggest is that the educational science shows us three key things. Number one, when it comes to the message, we do not download information as a flow. And what we have to do is allow for processing through higher order thinking, that Bloom's taxonomy. Number two, when it comes to supportive media, that is exceptionally distracting from the message, to the point at which people will usually end up processing only one thing, and that is usually text. And step three is that, as this slide shows us, delivery changes everything. So the up the nostril view, or the fact that I'm looking at you through the lens like this, makes it difficult for you to engage with me. Then it is even worse. That if your Wi-Fi is bad, you can even lose connection totally. And so the online milieu does affect that. But we have to realize that me talking to you with my finger up my nostril also changes the message, even in a simple way such as that. Delivery changes everything. And that whilst we may not be aware of the science that changes these things, there are 93 psychological principles that every PowerPoint presentation breaks. Oh yes, that doesn't change it from being bad to good just because we believe that reading out PowerPoint is the best way. So we have 5 minutes for questions. And what I would like each of you to do, each group is ask one question. So I'm going to go to group one first. So they should be thinking very hard, but the rest of you just come up with one question about anything that we have been talking about in today's presentation, and I'll go round the groups individually. I'll summarize at the end and I will finish at 10:30. So group one, any question that you want. It doesn't have to be a group decision, just one question. Go.
All right, I think we're unmuted. So I really agree with most of what you've said, and I accept it to be based on evidence. But next time that we're going to Trondheim and they're asking me to do a presentation, I'm probably going to be even more scared than I was, before giving my presentation earlier this week, because I
Why will you be scared?
How can I improve and be
How
better?
can you improve? Okay. How you can improve is invite me back, which I think Mass is going to do, and I will lead a workshop on how to improve presentations. But what I would say to you, Doctor, and to all your colleagues is that you are all actually now better presenters because you are considering education in a different way. It is a challenge, but let me suggest to you this. The challenge that you have is to meet the expectations of being better, whereas previously, with no knowledge that things weren't very good, simply reading stuff out, your presentation was actually destined to be the same as everyone else's, but not effective. So here's the risk, that you be better and communicate better, or that you weren't any use. That's a risk that each of us needs to face, and that if you want to improve, you already have done so. How to do even better? Go to my website. My website is, I'll put it into the chat, but the easy way to find it is how to do a presentation. So if you put in hashtag HTDAP, how to do a presentation, that will get you there, but I'll put it into the chat. Group 2.
Yes.
Yes.
We actually have 2 questions.
No, you're
The
allowed
first
one.
Yeah. Oh yeah. Okay. Yeah. So the first question is, knowing all this, with all this evidence, and this is not new evidence, why is it still this way all the way around?
That's a very good question. And I think if I could answer that, I would have changed the world. The suggestion I have is that this is the worst virus in the world. And I do mean that. I accept that COVID was horrendous and you had to deal with many, many problems. But I believe that this virus kills education, as one of your colleagues said, and that education saves lives. QED, bad education, fails to save lives. Therefore, this is a problem. It doesn't change because we all accept that this is bad and do nothing about it. The answer to your question, therefore, is be the change you want to see. Start to be better presenters, challenge the poor performance by encouragement, not discouragement, and slowly but surely, you will have better education. Mass is a perfect example. He leads by example, and he shows you how to give better presentations. And I suspect you're not aware, therefore, of how things have changed in the last 5-10 years because of people and experts like him gently leading in you the way to be better. But be the change you'd like to be. I'll come back to group 9 at the end who are with you. That's why you're saying there's got 2 questions. Group 3.
Yes, so we were talking about, is it realistic to ever learn more than 3 things from a lecture? And if not, should we set our aims to only teach 3 things?
It is realistic to learn more than 3 things, but what you should learn is concepts, not facts. So if the concept is of the contractility of the heart muscle, that's better than learning 3 things that shift the chart to the right. So yes, of course we can, because learning is not simply data retention. It's about processes and understanding. So yes, we can move beyond that. Group 4.
We were talking about pictures. Or supportive media. We all like the pictures where it's saddle children or funny face children. Do they help our presentations? Do they engage our audience more?
There is evidence that pictures definitely engage the audience. And if you're talking about a 57-year-old man who has who has sudden crushing chest pain, and you put up my picture, then that is more engaging than simply the text. So yes, images do matter as long as the audience can both connect with them and connect with your story. So if I was to put up a picture of a glass slipper, you would immediately connect with the story about Cinderella. So yes, it does make a difference. I'm going to keep pushing on to finish as close to 5:30 as possible. Group 5. Whoa.
Well, yeah, well, I can keep on talking. My favorite thing. No, we do you have any kind of tips on how to kind of boil a subject down then, or how do you go about if you're asked to kind of hold a lecture on this subject for I don't know 20 minutes and 10 minutes of discussion?
Yes,
do you have any tips about that?
Yeah, it's very easy. If you have to give a talk for 20 minutes, write a talk that will cover 5 minutes. And in those 5 minutes, you will have boiled down what you think are the essentials. Then consider that if you should even speak for 20 minutes, because the best presentations, TED Talks, are only 17 minutes, 13 to 17 minutes long. So strip it down to 5 minutes and you'll find what you've got in there is actually key. Group 6.
Yeah, well, thank you for a great talk. We were just wondering if you could just point out one main point that we would remember when we leave this course from your talk. What would it be? What is the most important thing you have told us?
The most important thing is that we need to understand what learning is. And once we understand that, we will be better teachers. What is learning?
Thank you.
Thank you. Group 7.
We are here. Our question is about the supportive media. What's your opinion or advice on skipping the PowerPoint and moving backwards towards all Blackboard education? Do you have any thoughts or experience that you want to share with us?
Yes. Absolutely. I have a lot of thoughts on that. My encouragement to you is mostly when I ask people what was the best presentation they ever saw, is they say it was when the professor turned up, she couldn't get her slides to work, so she just spoke to us for an hour. So actually, many supportive medias make things worse. We can work at making them better. I hope you feel that mine has added something to what's gone on, but it's not fundamental. So think less slides, more eye contact, and more discussion, because mostly what the stuff behind us does is makes it worse. Okay, group 8.
What's your best advice to improving the presentation from here?
Invite me to give a workshop.
Okay.
Okay, beyond that, it's on my website, which I put into the chat, is at foliate.com, and there's a ton of information there. Or the best book in the world is called Presentation Zen by a man called Gar Reynolds. I'll put that in the chat as well. My best advice, though, is that you are already better because you are already considering presentations, and that will make the difference. Simply because you consider differently how to educate. And as I said to, I think it was group 6, you are thinking more about learning than teaching, and so you will understand to be a better presenter. It's a journey, though, and it's a skill, it's not a gift. In the same way, the very first intubation you did was exceptionally challenging. You possibly even tried to do it right-handed, and now you're an expert in that. Presentations and teaching is a skill that we need to work at. It's not a gift simply because you're a chief resident in anesthesia. Group 9.
I think most of I think our question already got covered, so I'm not sure we have any more.
All right.
Or else we would just be going along the lines of how could we get better. So if you have more advice on that, you can do that, and then.
Okay, so my advice is my summary, which I will close with, because I firmly believe that all education should be interactive, that you should have a time to process, but also at the end, the teacher should summarize to make things simple. As group 6 asked me, ultimately what we should do is to think more about learning than teaching. How do we help people learn? My best advice for great presentations is have one identifiable message so that you change it from the what of a delivery of tons of information into an identifiable message. My identifiable message here is think about learning. For the supportive media, we should have less. We should illustrate what we're doing and not annotate it. And for the delivery, we need to recognize that this is a performance and we need to make everything as good as it can be for that delivery so that we engage the audience, we have passion and enthusiasm, and that will change opinions more than data itself. My friends, thank you for the opportunity for sharing. I am disappointed that I am here in Sheffield and not with you in Odense. I would love to come and visit you. Visit my website, there's information, ask questions, send me email, and be better educators because already you are. Thank you, thank you.